Hi guys, how you doing? This is LaQueen Terry Battle. I'm coming live from the Boston Harbor here in beautiful downtown Boston, site of the Boston Massacre and the site of the Tea Party here in beautiful, it's about 55, 60 degrees. It's really windy, it hasn't rained yet. It's beautiful. I got my little face mask on, which is great, great, great. So I'm doing a new series here on, it's called TPR, Temperature, Pulse, and Respiration. Right now going through the COVID-19 series. As you know, the whole entire United States government is closed down. All businesses, all restaurants, all churches, all synagogues, all mosques, everything is pretty much closed down except essential items, essential needs, food, shelter, and pretty much Walmart and Target and essential department stores are completely open. Those are very essential. So what I wanted to talk here a little bit about my series is temperature, pulse respiration, TPR, and how vital it is important for nurses and clinical staff to pay attention to and monitor these these essential items in a patient, whether that patient has COVID or whether that patient has pneumonia or whether that patient is elderly or young or even a 3-day old infant. It's very, very important to monitor these symptoms in patients and dealing with people every single day around, especially with the government closures, store closures, and everybody's pretty much shut down and just at home, um, stay at home requirement by law, mandated by law, is very important for clinical staff, nurses, CNAs, medical assistants, doctors, nurse practitioners, everybody on the clinical team, as well as the social work team, to recognize how important and how vital that these symptoms are in somebody's life. And so the first thing I'm going to deal with here is I'm going to tell you a little bit, introduce myself. My name is LaQueen Battle. I'm a medical assistant from Fort Worth, Texas. Been in Chicago, Southside Chicago, last 6 years. Been in New York for the past year and a half. And I have done my medical experience all over the United States, from Los Angeles to Houston to Dallas to Chicago to Florida, Tampa, Florida, Pensacola, Florida, and even New York. I use my medical experience, and Southside Chicago, I use my medical experience not just to help myself, not just to be out there saying, oh, I'm in the medical field or whatever, but actually to help out somebody else and to be the need and essential need for somebody else in their life. And so I think it's really, really important to recognize how vital it is that you are important to somebody's life, how extremely important it is to pay attention to the little bitty details in somebody's life. So bear with me if I stumble a little bit. Bear with me if I stumble a little bit. But I'm here in beautiful Boston Harbor, and right now I don't really I'm not employed right now, but I'm taking every single opportunity I can to keep my credentials, to be employable, to be interviewed, to continue to read and doing research on everything that I can possible in a medical field, and still pursue my future goals, which is becoming a registered nurse or a nurse practitioner or a PA or even eventually a doctor, whatever my career goals are in life. I always want to be able to use this every single experience every single day of my life for a reason. I don't want it to let it to go to waste. I don't want anything to go to waste. And so that's pretty much how it is right now. I'm dealing with a lot of pressure, but I'm trying to pretty much focus on what I need to focus on. So the first priority is temperature. T stands for temperature. Temperature signals how high somebody has a fever, or if they have a high fever or a low grade fever. And especially when you're dealing with somebody that has COVID, sometimes it can be walking pneumonia or it could be regular pneumonia, and you never know if they're positive for one of the top symptoms of dealing with coronavirus or COVID-19 is if somebody has a fever, if somebody has a fever over 24 hours. And so you have to monitor those symptoms in somebody, especially dealing with COVID-19 patients. A temperature over 99 point, this a temperature over 99.0 is very, very, very important dealing with COVID patients. It's a little shaky here on the harbor bay. It's a little shaky. So you're dealing with somebody, especially dealing with COVID patients, it's very, 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 very important to to take their temperature and to monitor their temperature and to do the very, very best that you can as a medical professional in dealing with the capacity to take care of their life, to take care of their issues, and to monitor their lives as best as you can possible. So it's very, very important to take care of these essential needs. Temperature is very important because temperature is basically the metabolism of the person's body. Temperature regulates the homeostasis system of somebody. So you can tell if somebody has an immune problem just by their body temperature, and not just a regular temporal swab, but it could be an auxiliary swab, or it could be an ear thermometer, which is really one of the best ways of taking somebody's temperature. Bear with me, I might stutter a little bit. Bear with me, I may stutter a little bit, but it's one of the best ways to take care of somebody's temperature is through their ear or through their mouth, as well as rectally when you're dealing with babies. Temperature helps regulate the body. It helps monitor the body. It helps to tell if something is going on. It has the immune system to fight off viruses, to fight off germs, to fight off any kind of infection in the body. Is how you tell if there is any kind of problem in the human body is pretty much by the overall average body temperature. And so if there is a problem, especially if there is an immune problem or an infection problem or a virus or a cold or any kind of small sickness in the body, number one, you can check it by their temperature, and the temperature regulates the homeostasis body of the symptoms. Very much a little close, you might do it wrong. So the temperature regulates the homeostasis part of the body and the body's symptoms. It tells if there is something, like I said before. Like I just said before, if there's something completely wrong with the person. And when you're dealing with COVID-19 patients, the number one symptom of a COVID-19 patient is if they have a high temperature. And that person may feel okay. That person their skin may be a little flush, or their skin may be completely red, completely purple. Their lips may be purple, their nose may be purple flush, their eyes may be red, their ears may be purple and flush, and their skin may be a little bit more cold. But the main reason you can tell if somebody has COVID-19 is by their body temperature. That's number one. Wherever you go, in the airport, in government, security, wherever people are going, all around the world, that's the number one symptom of somebody dealing with COVID-19 is their body temperature. And personally for myself, I physically, as a patient, I physically did not feel that I had a fever, but when I was finally tested through my ear, and when they finally did an oral temperature, not just a regular temporal temperature around my forehead right here, but when they did it through the ear and when they did it through my mouth, that's how they knew immediately that I had a fever, that something was wrong with me, that I was supposed to be discharged, that I was supposed to be admitted into the hospital. So it's very, very, very important to check the body temperature. The body temperature is very important. It helps regulate the immune system. Because the way the body temperature works, it works through the heart, and the heart is the flow of the blood. And so oxygen comes into the body, and it flows from the heart to the lungs. It flows in and out of the body through the nose, nasopharynx, and out into the mouth, the vocal cavity. And so I still have a lot to learn. I'm just a medical assistant. But again, the temperature is the number one factor of dealing with patients with COVID-19 virus. The temperature, the body temperature, the body temperature is very, very important to note this. Please note this, and please clinicians as well as clinical staff, pay attention to the patients. Ask the patient, not just don't just take their vitals. Don't just tell, okay, let me take your vital, let me take your temperature, let me take your blood pressure. Ask them, how are you feeling today? Is your skin flushed? Do you feel pale? Do you feel sweaty? Are you tired? Are you nauseated? How do you feel? And then, do you feel hot? Do you feel warm? What is the weather like today? On a scale from 1 to 10, are you in any kind of pain? Keep asking them questions, keep pondering them, because physically that person may not feel any kind of symptoms, but their body, especially their body temperature, may tell them something completely different from how they feel. So one person's feelings may be completely off kilter, a little bit different from what their body system is telling them. So right now it's like a 45-degree beautiful day here in Boston. It's a little chilly and windy outside, but my body's telling me it's cold. But I'm a young person. I'm still in my 30s. I feel, oh, this is fine. Oh, the weather is beautiful. Oh, I can wear a short sleeve shirt and leggings and I feel fine. I feel great. But in reality, my body is telling me I need to put something on. I need to cover myself. I'm a little chilly. I'm a little tired. That is what my body is telling me. But as a young person, especially when you're dealing with young people in their early 20s and teenagers in their early 20s and 30s and even 40s, how they feel is different from what their symptoms are. It's very, very important to know how, especially when dealing with a young person, how a young person feels is completely different from what their body's symptoms are telling them. So a person may have walking pneumonia and not even know it and be tested for COVID-19 and may just be completely working 40, 50, 60 hours a week and may have walking pneumonia with a temperature of 100, 103, 104, and 105 and may not know it. And a couple of days later they pass out at their job because again they didn't know that their body symptoms were telling them something completely different. So this is the start of it. I'm going to go ahead and finish this. This is about 10 minutes into my video. So it's very, very, very important to pay attention to body temperature. Body temperature helps regulate the body as well as it helps metabolize the body and lets the body know there's something going on with the immune system, there's an infection going on, there's a virus going on. We need to come in and attack it and regulate the body to its normal range, because that's how metabolism works. It helps equalize the body, helps equalize the hormones, it helps equalize the oxygen in the flow, because without oxygen we can't breathe. Without oxygen the heart can't beat. And so the body's temperature is very, very important to know what level of oxygen is going to the brain, as well as our body temperature. Again, like I said before, again and again and again, it helps metabolize and it helps regulate our whole entire system in our body. That's why it's very important for clinicians to ask questions and ponder, especially, like I said before, when you're dealing with young people. When you're dealing with young people, how they feel is different from what their body symptoms are telling them. How they feel is different from what their body symptoms are telling them. It's very important to know. Okay, so this is my first part of my series, TPR. The first part I did today was temperature, and the other two I'm going to deal with is pulse and respiration. So this is LaQueen Terrier Battle, coming from beautiful Boston Harbor Bay here in Boston, Massachusetts. It's beautiful here in Boston. I'm just going to let you guys show you a little bit how beautiful it is here on the Boston Harbor, how beautiful it is here. I'm going to upload this to YouTube today. Today is Monday, May the 4th. Today is Monday, May the 4th. I'm still interviewing for COVID jobs as well as for medical assisting, and I'm thankful for every single day that I have to live and breathe on this earth. I'm thankful for all the organizations that have helped me, especially here in the Boston area, as well as shout out to my little brother, Lakeem Jamari Harris, currently serving the United States Marine Corps. I know, Bubba, you're going to hate it when I keep saying your name, but your little sister loves you. Your little sister loves you, as well as to my cousins and the sons of Manzi Clay, who are currently serving the United States Marine Corps and United States Navy. Also shout out to my Aunt Darlene Mercer and my grandfather Jack Battle, my grandfather and my great-grandfather Jack Battle, who served in the United States Army, as well as to my unit, my commanding unit, 94th General Combat Hospital, 90th Regional Command, currently serving outside of St. Louis, Missouri, Little Rock, Arkansas, and Seagoville, Texas. This is LaQueen Battle, coming from beautiful Boston Harbor Bay in Boston, Massachusetts. Beautiful Boston, Massachusetts. Love you guys. I try to keep it short and simple. Peace and love. Bye.